talk to you all about today is the big debate that's out there in social media, specifically around the To Kegel or not To Kegel conversation. And I think that it's really important that we sort of get to the bottom of it, understand that there's a lot of clinical reasoning that goes beyond or goes behind each of those decisions. And really, if we don't sort of appreciate that, that we're ultimately confusing the public with this very public debate. And so I'm really hoping that we can have a conversation here that would help us be agents of clarity out there, and to really sort of get to the bottom of how we might make those decisions, but also to, move sort of beyond that conversation. And this particular debate, To Kegel or not to Kegel, is actually not a new conversation. Because I'm so old, I'm actually also an early adopter of social media. And so we had this knockdown, drag out in the past. And we moved beyond it into starting to appreciate some of those additional variables that we can use to influence the health of the pelvic floor and influence pelvic health alongside of musculoskeletal needs or performance needs. And we do understand that there's so much more that we can offer. However, it doesn't negate the value of the Kegel or the pelvic floor strengthening. And so I'm actually not here to choose sides. I'm here to find our way back to the middle and have a really good conversation about all the clinical reasoning variables we can use, and to understand where the Kegel might fit into that broader picture, and so that we can then keep moving forward. And so we are going to find our way to the middle through just trying to understand how we can make those clinical decisions. We're going to talk about where to next, like where is the new research, because we're getting a lot of it, which is exciting. Like, where is that leading us? And part of that, I'm excited. My 2023 pause that they were so patient around, I was actually able to complete some of my own research. And so I'm excited to share some of those results with you. And then how do we take some steps forward? How do we sort of alter the way that how do we pull all those pieces together in a cohesive way when we're working with clients?